let us understand what is pain. So International Association for Study of Pain, IASP, has laid down a very clear definition of pain. That pain is an unpleasant and an emotional experience which is associated with actual or potential tissue damage, which is described in terms of such a damage. It is when a patient says that it hurts. When he or she says that it does, we have to believe the patient, regarding of his or her pain. It is more than an information, it is also an emotional experience. So there are various reasons for pain in cancer patient. Let us understand the nature of pain. It is acute pain or chronic pain. Acute pain is something where the autonomic responses are more dominant. It is self-limiting at times, but however, the intensity can keep changing depending upon the type of underlying process that is happening, infection, inflammation, pressure, etc. It also does play a protective role, but differential diagnosis is very important. If we look at chronic pain, it is multifactorial. There could be many reasons. It is progressive. It is also a constant reminder that there is an underlying cause which is not fully resolved. And pain itself can become the characteristic of a disease. And in cancer, if we look at pain categories or types of pain, many a times we do see that disease itself is not the cause for pain. So pain can be classified as disease related pain, treatment related pain, debility related pain, or any other comorbidity which is leading to pain. When we divide these categories in this way in cancer, we will be able to classify as cancer pain and non-cancer pain. When we have this clarity, Ayurveda can help to assess this very clearly, and depending upon the cause and the nature of pain, our approach lies in a fourfold, I would say a fivefold prescription, where ahar, that is diet, vihar, that is lifestyle measures, some of the inputs that are told with respect to change in lifestyle which can help in to mitigate pain, aushad, various medications depending upon the algorithm and pathway of pain, medicines are planned. Medicines could be both external as well as internal, and panchkarma therapies, kriyas. It could be a medicated pouring of a liquid, poultice application, bandage, or going through some systemic process of cleansing if the patient is stable. And the fifth most important element is also mind, vichara, addressing manas, because as we spoke about pain as something as an emotional experience, that there may not be an actual pain but there may be a suffering. So identifying that will help the patient to minimize that suffering. So all in all, we do use contemporary scales like visual analog scale. It's various kinds of cancer related measurements like CTCAE, Karnofsky, EORTC, QOL scale. Various standard outcome scales are used to measure pain, adverse effects, and quality of life. When we take some particular situation so that the participants here, the audience is able to relate, let's take example of a very common situation which is very painful, which is peripheral neuropathy. So most of the cancer patients who undergo chemotherapy go through a class of drug-induced chemotherapy, that is taxane-based chemotherapy. And this group of drugs are known to cause lot of nerve injuries, which leads to tingling sensation, numbness, pain, discomfort, pin pricking sensation in hands, legs, and in peripheral extremities. In such a situation, for some time, conventional medicine certainly can help with medications like gabapentin, painkillers, etc. But it does have its own limitations. Ayurveda can come in and make a significant difference in such a situation, where Ayurveda physician, in discussion with the oncologist, comes up with a care plan which looks into assessment of peripheral neuropathy and plans external treatment as well as a prescription which helps to address numbness, pain, burning sensation. And from an Ayurveda perspective, we do see that there is lot of pitta and vata involvement in Rakta. So knowing these classifications and the srotas is involved allows us to come up with a proper prescription which helps to address peripheral neuropathy. At times we do see patients with diabetes neuropathy overlapping with peripheral neuropathy, which is because of cancer treatment. In such a situation, the pain becomes lot more pronounced, helping the patient to improve peripheral circulation, giving a better sugar control, planning diet and lifestyle helps to improve the outcomes overall. So various kinds of pain, as I told, whether it is disease related, whether it is treatment related, whether it is because the patient is in a state of debility, or is it because of the underlying comorbidity. Ayurveda helps to identify the nature of pain and the exact pathways and helps with a holistic approach of addressing pain.